think the clinical sensitivity has not completely been worked out. That's sort of a subject of active investigation. But for the nasopharyngeal swab, it's probably upwards of like 95% because it kind of defines the disease. So it depends on what clinical syndrome you're describing for your testing. But that's something that I think people should be aware of, is that no test is perfect. And I think our biggest issue right now is making sure we have the swab touching the right place of your respiratory tract for getting the best result. Sorry, that was some real inside ball there in lab medicine, but it's real talk.
Fascinating. Yeah, totally fascinating. And I know that we're going to let you go in a minute, and then I'll continue to take questions. But here's one last question for you. This is from Cheryl from Zoom. Can you give some guidelines for those of us living in apartment complexes? I just found out that someone in the building has tested positive and is in the hospital, and I'm not sure what to do.
Wow, that's sorry to hear about that. I think the first thing I would say is to contact the Department of Health. When it's in King County, I would actually ask them, because there could be changing guidelines. I can sort of offer you sort of a personal sort of viewpoint on what you can do, but I think as there are different guidelines and thought processes on that, and this question does come up, I think first things you can do to protect yourself is worry about sort of contact surfaces. So, first, not contacting surfaces, not touching things that you don't need to touch, will help reduce transmission. Alcohol-based wipes or alcohol-based disinfectants for your hands work quite well with Purell. That's why there's a Purell shortage, right? But alcohol-based wipes, soap and water worked great against enveloped viruses like coronaviruses. And then the bleach wipes as well worked very well against specific surfaces for areas that you might touch in the apartment. It is also a reason to sort of be at home and try to isolate to your own degree, and to prevent those sort of other transmissions that can occur via touching surfaces and closer living situations.
Yeah, and actually my team is contacting some distilleries in the district, because there are some distilleries, one in Oregon, Shine Distillery in Oregon, that was creating sanitizers, distributing them for free, which was amazing. And so if we have some folks like that can do it in our district, that would be fantastic. Dr. Greninger, I'm going to let you go. I'll continue to take questions from folks, but just want to say thank you so much for your work and for just sparing a little bit of time. I know how busy you are. We really appreciate it, and we are grateful to you. Thank you.
Thank you very much. Appreciate it.
Wonderful. So we're going to continue to take some questions that have come in from social media. And so the first one is a constituent call to ask, how can we keep people in their homes without risk of eviction or foreclosure? And this is just incredibly important. And as I mentioned earlier, on the call, the governor has today, Governor Inslee ordered a 30-day statewide moratorium on evictions. The cities of Seattle and Burien have also ordered moratoriums on rent-based residential evictions, and the King County Sheriff's Office will not serve or enforce evictions on foreclosures for residential and commercial properties during this crisis. So we know that there's more that is needed. And as I mentioned earlier, actually, I don't think I mentioned this earlier, along with two other members of Congress, I sent a letter to the major mortgage companies today demanding that they stop all foreclosures during the COVID crisis. And we're working on additional relief bills that would provide some more relief to tenants, to people who are trying to pay their mortgages, and people who are experiencing homelessness. And I just want to also remind everybody, I know we're a compassionate community. It is deeply important to treat people who are experiencing homelessness as valued members of our community, and to give them safety and respect as we do so. Okay, the next question I'm going to take came from Instagram. I'm concerned about how this will affect workers who are losing pay, people held in detention centers and prisons, and folks who live outside. And I'm also concerned about current ICE raids. I am with you. This is a really important question. And those of you who know me know my history on immigration, and you know that this has been one of the issues that I've continued to lead on in Congress. We know that ICE has a terrible track record for keeping people healthy and safe in detention centers. There are 8 people who have already died in ICE custody just this fiscal year. And there have been numerous calls for ICE detention centers and prisons to reduce their populations in order to promote public health inside. I have also been calling for updated measures to keep people healthy on the inside, including just some really simple things like waiving commissary fees on soap and other hygiene products. And I'm working right now to call upon ICE to stop all arrests unless someone poses a really significant public safety risk, and to make sure that ICE does not do any arrests at hospitals, health providers, social service providers, sensitive locations. Everyone deserves the opportunity to stay healthy during this crisis, regardless of their immigration status or involvement in the criminal legal system. And then I mentioned earlier that one of the things we're calling for is to actually release people out of the ICE detention centers who don't need to be there. There are a lot of people out of the 56,000 that are held in ICE incarceration centers every night. The vast majority have never committed a crime, much less been charged of a crime. They are there often awaiting asylum procedures, other things. And we think that this is a perfect time to use alternatives to detention, so they are not in those facilities and not able to practice any kind of physical distancing. Next question, somebody tweeted, I am your constituent, I have a small business, and the only way that I won't fold is if I get some working capital infusion. This cannot be a tax credit for the next year or a loan that I need to take on. Business owners need 3 months of working capital grants. Yes, we had a call yesterday with small business owners, and a big part of our priority package that we're putting forward for this next package is actual immediate assistance. So ideally in the form of grants, forgivable loans, or other means that don't require a payment to come due later on. And also that we want to address the issues of rent. In an ideal situation, we would be forgiving rent for small businesses, making sure that your utilities stay on. We could also do it through giving a landlord potentially some incentives to do that. We're working on the details of that, but we hear the urgency of this, and it is going to be a big priority in this next piece of legislation that hopefully we pass next week. Brian on Facebook asked, will there be changes coming from the IRS for payment of taxes? I suspect that many people won't be able to pay by April 15th. So yes, that's a great question. The IRS actually announced earlier this week that it has postponed the deadline for filing taxes by 90 days to July 15th for individuals who owe $1 million or less, and corporations that owe $10 million or less. So there is a bit of relief there. The question here is about, from Facebook, we were already in a children's behavioral health crisis, and programs supporting families are shutting down. Will you please consider proactive mental health supports to all families during this time? Yeah, this is really, really important. You know, I've been calling this physical distancing instead of social distancing because honestly, I think what we need to do is be connecting. We need to really try to support each other as much as possible. I know in our office, we're doing Zoom calls instead of just telephone calls, just some level of interaction with other folks. And we know that there are real mental health questions out there. And we want to try and make sure that we are addressing some of these behavioral health issues that are coming forward and being exacerbated by the crisis. So we are going to try to make sure that we get some mental health supports to all families in this next package. And, you know, there are going to be a number of packages coming forward. And so we will continue to add to whatever we can get done as we go through. So I think that it is 6 o'clock. We started a little bit late, but I do want to make sure we stick mostly to the time that we have. So I know we didn't get to a lot of questions, but that's all the questions that we have time for tonight. And just as we did after our last teletown hall, my commitment to you is that my staff will go through all of these questions and we will make sure that you get a response as long as we have your contact information. And we are going to continue to do as many of these as possible. This is the first Zoom call that we've done. So it looks like we had a really fantastic response both on Zoom and on Facebook Live. So we will continue to take this format in, as well as making sure that we use all the other formats that are available to us. If anybody is not on our email list, we send a lot of updates out by email. Please go to my house website, which I don't have in front of me, but maybe somebody, Subhan, can give it to you as we close up, and make sure that you sign up for that email list so that you get the most up-to-date emails from us. I am really committed to ensuring that you have the information you need during this crisis. And as always, my office is here to help. And I just want to thank my incredible staff, both in the district office and the DC office, for just remarkable work to try to help constituents through everything that you're going through, and also to help me push for the things we need in these legislative pieces. Let me end with this. Some of you have heard me from time to time paraphrase the lead vocalist of Alabama Shakes. Her name is Brittany Howard. When she was on NPR, she described the ruptures in our society that need healing at this moment in time. And this was before the coronavirus pandemic. It has become clear to me that the ruptures that were caused before we ever reached this pandemic are coming to light in this pandemic. Many of those underlying problems and inequalities that our country has been facing for years. In fact, in some cases, decades, a disinvestment by the federal government in basic infrastructure, including our public health system, so that we have a Medicare for all system, so that we have free tuition for higher education. Much of that disinvestment in that basic infrastructure is coming back to bite us now. And it's really, I think this crisis has revealed the problems with what I call a me first instead of a we first society, a society that fails to recognize how deeply interconnected we are, and that too often privileges the wealthy and the well-connected over the common good. But this is also a moment when we the people, get to reclaim the best of who we are as human beings, and to radically rethink what our society should look like. So over the coming days and weeks, I hope that each of you will be safe and healthy, that you'll stay home, that you'll take every precaution you can take. And I urge you to please implement the public health best practices that we've all been encouraged to take. I also hope that you'll find time to take care of yourself and others around you, especially elderly neighbors, especially pregnant people, new parents, people with disabilities who may need assistance with groceries or household tasks, and who happen to live on your street or in your neighborhood. I hope that you'll share where you can, since there's probably always someone who has less than you do. And I just hope that you breathe in generosity and love and abundance, and breathe out anxiety, fear, and scarcity. And I hope that you tell the people that you love them, and know that there's no shame in asking for help if you need it. And thank the workers that are still doing the work that we need done, the many public health workers, the first responders, the garbage collectors, the grocery store workers, the food suppliers, the truck drivers, the government employees, the service providers, and so many more that are just keeping things going during this crisis. We are strong, we are incredibly resilient, and we will weather this together with open hearts and with all the sadness and the joy that those open hearts allow us to feel. So thank you so much for joining us. Stay in touch, and we will too. Thanks, and have a great evening.
Thank you for joining us tonight for our online briefing. To sign up for the Congresswoman's newsletter, you can go to jayapal.house.gov/newsletter. Again, that is jayapal.house.gov/newsletter. Thank you and good night.